Learn with Agrikema.
Vaccination is one of the most important practices in poultry farming. It protects birds from deadly diseases, improves flock survival, and ensures consistent growth and egg production. Without proper vaccination, poultry farms are vulnerable to outbreaks that can cause severe economic losses. Preparation before vaccination. Proper preparation is essential for effective vaccination. Farmers should first understand the correct vaccination schedule based on age and type of birds, whether broilers or layers. Vaccines must be stored correctly. They should be kept in a cooler or refrigerator between 2 and 8 degrees Celsius. Vaccines should never be frozen or exposed to direct sunlight. Water used for vaccination must be clean and free from chlorine, since chlorine can destroy vaccine viruses. Many farmers add skim milk at about 2 grams per liter of water to protect the vaccine. All equipment used during vaccination must be clean and properly disinfected. Syringes, droppers, and water containers should be rinsed thoroughly to avoid contamination. Farm workers should also be trained and assigned specific roles. Some people handle the birds while others administer the vaccine. Vaccination should preferably be carried out early in the morning when birds are calm and temperatures are cooler. Sick, weak, or stressed birds should be separated and not vaccinated until they recover. Starving birds before vaccination. In some vaccination methods, birds must be temporarily deprived of feed or water. This ensures that birds consume the full vaccine dose quickly. When vaccines are administered through drinking water, water should be withheld for about 2 to 3 hours before vaccination. For oral drop vaccines, feed or water restriction may last about 1 to 2 hours, although in some cases it may not be necessary. When vaccines are given through injection, starvation is not required. For eye or nasal drop vaccines, feed restriction may also be optional. In cases where vaccines are mixed with feed spray, mild feed withholding for about 1 to 2 hours may be recommended. Farmers should avoid starving birds for too long, since excessive deprivation can cause stress and weaken the birds. Immediately after vaccination, birds should be given access to clean feed and water. Vaccination schedules vary depending on farm conditions and regional disease risks, but a typical program includes the following stages. At day 1, chicks are vaccinated against Marek disease, usually through a neck injection at the hatchery. At 5 to 7 days, birds receive the Newcastle disease vaccine, commonly administered through eye drops or drinking water. At 10 to 14 days, chicks are vaccinated against Gumboro disease, also known as infectious bursal disease. Between 14 and 18 days, birds may receive the fowlpox vaccine, often administered through a wing stab method. At 3 to 4 weeks, a booster vaccination for Newcastle disease is given to strengthen immunity. At 4 to 5 weeks, a Gumboro booster vaccine may be administered, especially in high-risk areas. Between 6 and 8 weeks, birds may receive vaccination against infectious bronchitis, often combined with Newcastle vaccination. At 10 to 12 weeks, vaccination against fowl typhoid may be carried out in areas where the disease is common. Before birds begin laying eggs, typically between 16 and 18 weeks, a combined vaccine protecting against Newcastle disease, infectious bronchitis, and egg drop syndrome may be administered. After birds reach production age, booster vaccines such as Newcastle disease vaccination every 2 to 3 months help maintain strong immunity. Tips for effective vaccination. Successful vaccination depends on proper management. Farmers should use timers or schedules to ensure vaccines are administered at the correct time. Vaccine equipment must always be clean and properly disinfected to avoid spreading infections. Vaccines should be stored under correct conditions and used before expiry dates. Birds should be starved only for the recommended period, long enough to ensure vaccine intake, but not long enough to cause stress. Vaccination through drinking water is most effective when carried out early in the morning. Careful handling of birds also reduces stress and improves vaccination success. Vaccination is the first line of defense against poultry diseases. Good preparation, proper timing, and correct administration methods are essential for effective protection.